Good evening, guys, and I hope you are fine. Today we'll start the pathology of GIT, gastrointestinal tract, and we will start from the salivary glands and then discuss the esophagus and moving down towards the stomach and then the intestines. So let's get started. As you know that salivary glands are of two types. They are major and minor salivary glands. Major includes three pairs: parotid, sublingual, and submandibular. And the minor contains the minor salivary glands. There are many hundreds of salivary glands into the mouth and below the tongue and in the mucosa of the mouth. When discussing about the salivary glands, three, four things major come into our mind. That the structure of salivary gland is very important, histology, and then we'll discuss about the pathology. As far as the histology is concerned, first of all, the salivary glands consist of acinus, and we can call it plurally acini. Acinus can be serous or it can be mucinous. Serous means that it secretes watery protein rich fluid or material, and the mucinous means that it's secreting mucus, and mucus is viscous and it is thick as compared to the serous acini. Serous discussing is mostly blue and eosinophilic, means pink. The serous acini are darkly colored, means blue and pink colored spots can be seen under the microscope. But mucinous is more like empty. Okay, mucinous is more empty than the serous acini. And when discussing about the parotid gland, it's almost serous, and other glands like submandibular and sublingual are mixed, meaning that they contain both the serous and mucinous acini in them. Apart from the acinus is the ducts. Ducts means that the pathway through which the material is being drained. It means that the ducts are cuboidal epithelium. When we see under the microscopic examinations, we can see duct as the cuboidal epithelium. And in the diagram, you can appreciate that these are the ducts. Here, the cuboidal epithelium are present. Mucinous acini is like more empty spaces, but it's the structure of acini, and the serous acini is more colorful. Okay, you can appreciate here that more pink, and under the hematoxylin eosin stains we can see lightish blue and pink color. Also, you can appreciate that some white spaces are also present in the microscopic examinations. These are nothing but these are adipocytes. Adipocytes are also present in almost all salivary glands, and adipocytes, the count increases with the age. There is also an other kind of specific acini, that mucinous acini is present, and on top of that, like a cap, is the serous acini. As you can appreciate here, this is the mucinous acini, and on the top is the serous. So this is called as the demillion acini. Demillion acini means that half moon shaped acini, with half the serous part and half mucinous part. The histology is complete about the glands, and then moving towards the pathology. In this video, we'll discuss only the benign tumors of the salivary glands, and in the next upcoming video, we'll discuss about the malignant tumors. Benign tumors includes pleomorphic adenoma. The second is the Warthin's tumor, and the third is the oncocytoma. So let's discuss them one by one. First is the pleomorphic adenoma. Pleomorphic adenoma, the second name for that is the mixed benign tumor. Mixed benign tumor, as the suffix "oma" suggests that it's a benign tumor, and pleomorphic means that it has a morphology of mixed type. It means that it contains two components, an epithelial component and a stromal component. What does that mean? It means that the tumor, the oma, the suffix, the tumor contains two parts. It contains epithelial part and it contains a mesenchymal part or stromal part. Epithelial component, all of the epithelium is going to come here. Epithelial cells, the myoepithelial cells, the ducts, cuboidal epithelium, and the acini. It can be serous, it can be mucinous. The stromal element would have the matrix. Matrix means that all of the mesenchymal component is going to come here. Mesenchymal means that it's going to resemble chondroid, the cartilage, myxoid and mucoid. Matrix is going to come in the stromal elements. It means that when we are going to look at the diagram, you will see both of these components. But first, we'll discuss the etiology. The gene defect. It is the gene defect in the PLAG1 and HMGA2 gene. In these both genes, the chromosomal rearrangement is going to occur. This is the etiology for this kind of tumor. And how we'll remember that these genes are affected? P, it's mean pleomorphic, PLAG gene. Okay, pleomorphic adenoma gene 1 and HMGA2 gene. These both genes will have chromosomal rearrangement defects, and as a result, we are going to suffer from pleomorphic adenoma. Which gland is going to suffer most? The gland. The parotid gland will going to be suffered very much from this tumor, and it's the most common benign tumor from all other kinds. About 70% of cases is of the pleomorphic adenoma, and most common in females among the gender, and it's painless, about 2 to 5 centimeters in diameter, and it's whitish grayish color. Okay, coming towards the diagram, you can see that in the second diagram you can see, I will zoom it for you, that you can see the epithelial part. Are you seeing the epithelium and myepithelium, like acini and ducts are seen well, like tubular structures are appreciated in epithelial component, while as the stromal component, the mesenchymal component contains stroma. The stroma consists of mucoid, myxoid and chondroid part. Okay, and this is the epithelial part and this is the stromal or mesenchymal part. So in this diagram, both of the components are well seen. The gland affected is the parotid gland and it's the high magnification. Let's discuss some clinical case scenario that a female comes to you with a tumor of the parotid gland, but most of the doctors can just remove the tumor part, and they would expect that it would heal. But ironically, this tumor contains finger-like projections, okay? And even if removing the tumor part, the chances of recurrence can occur. The patient will come to you after 5-7 years with recurrence. The tumor will regrow. But here we should remove the whole lobe. The parotid gland contains lobe, okay, and lobectomy should be occur in case of the this pleomorphic adenoma surgery. There is also a case in which the cancer can arises in the pleomorphic adenoma. Adenoma, it's a benign tumor, but cancer can also arise in the pleomorphic adenoma, and this condition is known as carcinoma ex pleomorphic adenoma. It means that once upon a time it was a benign tumor, but now it has shifted to cancer, and it damaged the facial nerve. Facial nerve passes through the parotid gland, as you know the anatomy, and when this cancer occurs, it can damage to the facial nerve. But in case of carcinoma ex pleomorphic adenoma, the patient must have a past history of pleomorphic adenoma. Then we can suspect that this patient has a carcinoma develops in that past tumor. Maybe a scar, maybe a surgery in the area of the parotid gland, in the jawline. We can see some scar or surgery. This is the diagrammatic view in which this is the parotid gland and mixed salivary tumor. or pleomorphic adenoma can be seen. Okay. The second benign tumor is oncocytoma. Oncocytoma will discuss later because it is nothing but the eosinophilic cells abundance due to excessive mitochondria. Oncocytes mean mitochondria in pathology. In oncocytoma, there is nothing but there is the increase in number of cells, eosinophilic cells, and they contain granular cytoplasm due to excessive number of mitochondria in them. Coming towards the last tumor, benign tumor, is the Warthin's tumor. And Warthin's tumor is very important in examination point of view that because it's the most favorite question asking in the exams. And Warthin's tumor is also known as papillary cyst adenoma lymphomatosum. Why is called so? Every word in this name has its own meaning. Papillary means that there is going to be some sort of papilla seen. There will be some sort of cyst. Okay, cyst. Oma suggests that it's a benign tumor, and lymphomatosum suggests that some kind of lymphatic infiltrate is going to happen in this tumor. The name tells you the whole story. Let's see microscopically what happens in the Warthin's tumor. First of all, there are papilla. Papilla Papilla are like finger-like projections. Okay, as you can see here, I will use some other color for the contrast. That this is a papilla. Okay, and a lot of papilla can be seen in Warthin's tumor, but this papilla consists of cells over their surfaces. But are these one row of cells or two rows of cells? There are two rows of oncocytic epithelial cells. Oncocytic epithelial cells means that these cells contain lot of mitochondria. So the Warthin's tumor contained papilla, which is lined by bilayered oncocytic epithelial cells. Okay, these papilla are lined by double row of oncocytic epithelial cells. And what is called a lymphomatosum? It means that inside the papilla there is a lymphocytic infiltrates. Lymphocytes are present here with germinal centers. Okay, and in FNSC means that fine needle aspiration cytology, in which we take a needle and we aspirate some material from the tumor, we will going to see a murky fluid. Murky fluid is a very important landmark or hallmark for this kind of Warthin's tumor. We are going to see murky fluid on aspiration on FNSC. Okay, this was the Warthin's tumor, the papilla with bilayered oncocytic epithelial cells, and inside is the lymphocytic infiltrate. But classical case in which the examiners are going to ask you that adult smoker male. This is a history, a very classical history with bilateral parotid swelling. It means that a smoker male of 30 years old or 40 years old will come to you with bilateral parotid swelling, and you must suspect of the Warthin's tumor. The males are most gonna suffer from this tumor, and they would have bilateral swelling. Unilateral swelling can also occur, but bilateral is the most common. But if a child comes to you with bilateral swelling, it's not the Warthin's tumor, it is the microscopic disease, the mumps. Okay, it's infectious disease. It's mumps. Don't confuse it with the Warthin's tumor. In this diagram, you can see the location of the Warthin's tumor. It's the parotid gland, and just below the parotid gland in the area, there is the occurrence of the Warthin's tumor. So we have discussed three main benign tumors of the salivary glands. First is the pleomorphic adenoma. It's also known as benign mixed tumor. because it has two components, the epithelial and the stromal. The second is the oncocytoma. It's nothing but the cells with a large number of mitochondria. And the third is the Warthin's tumor, which is also known as papillary cystadenoma lymphomatosum. I hope you understand these benign tumors. In the next lecture, we'll discuss about the malignant tumors. Thank you so much.